Engineered stone could be banned across the country by mid-next year if state and territory ministers sign off on a draft agreement this afternoon. The national agreement will support the findings of a major report which shows a link between use of the material and lung disease in tradies. State leaders have remained silent on where they believe the legislation and when it could be introduced, but union bosses claim more blood will be on their hands if not imposed by July.
As many as 1 in 4 workers that is working with this product is diagnosed with silicosis or another form of deadly dust disease. It is unacceptable that this product is allowed to continue to be used in Australia, and it's unacceptable if there's any other decision today other than a ban on the importation, manufacture and use of engineered stone.
Joining me live now is Kate Cole, a Churchill Fellow and engineer and scientist who's been working to prevent illness and disease in the construction sector. Kate, how much is at stake with this prospective ban?
Well, to be honest, everything is at stake. We have done so much as a country to try to see how we can work with this product safely, and unfortunately, we just can't. We have seen new legislation, we've had lots of intervention by our health and safety regulators, the National Dust Disease Task Force, case-finding studies, and unfortunately, the more we dig into this issue, all we have is more evidence to demonstrate that we must ban engineered stone in our country.
We heard from the unions, the CFMEU, saying if the governments don't do it, they'll impose it via union-imposed bans. Would that be good enough?
I think, to be honest, what we really need is government leadership. We have heard that all states and territories support a ban on engineered stone, which is great, but what we need is an agreement. We need coordinated action. We need to stop the importation and use of engineered stone across this country, because until we do that, unfortunately, we're continuing to put tradies' lives at risk, and we will continue to see cases of a completely preventable disease in our country.
Indeed. And so how long have we known that this is a cause of disease, of lung disease for tradies, people in the construction sector? And if it is longer, then I believe we've been talking for the last couple of years about this issue. Why hasn't a ban been imposed sooner?
We've known that exposure to high concentrations of silica or respirable crystalline silica causes silicosis for hundreds, if not thousands of years. We haven't had engineered stone in this country until about 23 years ago, so this risk started about the year 2000 when we imported this product, when tradies were working with it, and when we didn't have good compliance and we obviously didn't have the right measures in place. And even now, when we have wet cutting, we still know that this product can't be worked with safely. So we've known this for a very long time. We've been working across lots of different ways to try to see how we can keep this product in our country, but unfortunately, based on the evidence that we have now, it just can't be worked with safely without, unfortunately, having more cases of silicosis in Australian tradies, and that's just completely unacceptable.
And Kate Cole, just finally, what advice would you have for those who might have the product in their homes already?
Well, the product itself, when you don't disturb it, is fine. It's completely safe. The risk comes from when you cut into the product or where you disturb it, or during renovation, for example, when you might need to take it out of your home. And if that's the case, you really need to get an experienced and licensed tradesperson to do that. It has to absolutely be done wet. People should be leaving their homes when that happens, and the workers need to be wearing high-grade respiratory protection, because this dust that comes from engineered stone is incredibly toxic, and we know that it causes completely debilitating and incurable diseases, and unfortunately that's the situation we're in and will continue to be in until we see an absolute ban of this product in Australia.
Kate Cole, we appreciate your insights, and we could see that ban as early as today. Thanks so much.
Thanks for having me.